prominent cancer researcher kept a deadly secret from her husband, who was also a cancer researcher and physician. Their story today on the Morning Medical Update. And good morning, I'm Jessica Lovell. How well do you know your spouse? How far would you go to keep their secrets? And how could a cancer expert at one of the most renowned cancer centers in the nation not only hide her own cancer diagnosis, but refuse treatment that could have saved her life? That is an excerpt written by our guest in a book that he wrote chronicling his wife's diagnosis of breast cancer. The book is called In Sickness, and we would like to welcome Dr. Barrett Rollins. He is a Lindy Family Professor of Medicine at Harvard Medical School and Chief Scientific Officer Emeritus at Dana-Farber Cancer Institute. And of course, he is an author. Welcome, Dr. Rollins. How are you?
I'm very well. Thanks so much for having me.
Thank you so much for being with us. And here in studio is our Dr. Roy Jensen, Vice Chancellor and Director of the University of Kansas Cancer Center. And he is the host of his very own podcast, Bench to Bedside. Good to see you.
Good to be back.
Yes. Well, many questions for both of you gentlemen this morning. But Dr. Rollins, I want to dive right into this secret that your wife, Dr. Jane Weeks, kept from you. So first, start by telling us about her cancer story.
Well, first, I want to say that your first remark, I have many questions, is something I hear from everybody. Everybody has lots and lots of questions about this. The story is that Jane was a brilliant cancer researcher, really incredibly empathic and skilled physician, a wonderful oncologist who really understood our field quite well. But about 20 years into our marriage, we were married for about 30 years, about 20 years into our marriage, as best I can tell, she developed breast cancer and kept it a secret. She didn't tell me. She didn't seek any medical care. We can go into some details about how her secret was revealed to me in a way about 6 years into her disease. And I became complicit in continuing to keep her secret and hide her disease from our colleagues. And about 4 years after that, she died.
So, and Dr. Rollins, you said it, but life and death is full of all sorts of questions, and that we don't always have the answers to. So I appreciate you, just opening up and sharing what you can and what you know. And of course, wanting to give you a chance to talk about your wife, Jane, today. But how long did she live with this secret? Tell us about that again. How long was she living with the secret before then you were revealed this secret?
Given the type of breast cancer that she had and how extensive it was around the time that she died, my best guess is that she probably lived with her secret for about 10 years.
Did you notice anything during that time? A lot of us are married and, our spouses maybe don't tell us everything. You never know. But, you think of something like, something weighing heavy on you like cancer. How do you think she did that? Kept that from you, of all people?
Yeah, it's a great question. And once I found out that she had breast cancer, it answered a lot of questions that I had had for a long time. What she did, as I said, we were married for about 30 years, and about 20 years into our marriage, there was this sudden, inexplicable ratcheting down of communication, of intimacy, of sharing. I tried many times to get her to open up about this and talk about it, and she simply wouldn't. In fact, Jane was very tough as nails. And when I would try to talk to her about this, once or twice she would cry, which honestly, in the context of our marriage, was kind of frightening. And so the way she did this was by shutting herself down. And it was a tough sort of last 10 years of our marriage to live with someone like that.
I want to show some pictures that you shared with us. Jane, beautiful, brilliant woman. Did you notice any physical changes in her? You said lack of intimacy, but anything physically that you were thinking maybe there's something wrong here?
Well, I don't know how much to share here. Well, I put it in the book. I might as well share it. So we had a wonderful relationship for a long time, and usually, slept without pajamas or nightgowns. And one day, again, around 20 years into the marriage, she showed up in bed with a neck-to-toe caftan that was zipped right up to her chin. And, that was a pretty interesting signal. I figured something was going on, but to be absolutely honest, I had no idea that it was breast cancer.
Yeah, it would have been an odd action perhaps, but yeah, it would have been hard to make that initial leap to something like a deadly cancer. Your wife, I want to talk again about when you discovered this secret of Jane's, because your wife initially shared her advanced cancer diagnosis with you several years before she then had that collapse at work. Tell us about that time at your home when this was discovered. It was quite jarring and quite shocking for you.
So it was a Saturday morning, and I was pottering around the house, and I heard Jane calling me from our bathroom, master bath. Door was closed, and I went to the door, and she said, come in. And I walked in to see her lying on the floor of our bathroom in that caftan I just mentioned, but unzipped around her neck. And underneath that caftan was a blood-soaked towel. And I looked at her and I said, my God, what's going on? And she looked at me and she said, I'm dying. Really, what's going on? And she said, I have breast cancer, and it has spread to my skin, and I'm bleeding, and I'm dying. And I said, well, okay, this is horrible. I'm going to call 911 right away. And she screamed at me, don't you dare call 911. I said, are you kidding? I've got to get you to the emergency room. She said, no, I don't want you to call 911. And if you do, I will never forgive you. All I want is to not die alone. So I sat there and I said, tried to convince her a couple more times, and she simply, would not comply. She had brought the day's New York Times into the bathroom with her. And she said, just read this to me. And so I ended up in this surreal situation of sitting in the bathroom with my wife on the floor, bleeding, telling me that she was dying. And I read the paper to her for about a half an hour. And after half an hour, it was pretty clear that she wasn't dead yet and wasn't going to die. And then she eventually said, okay, this is all over. Forget you ever heard about this and go about your business. And I said, no, I can't forget this. First of all, how do you know you have breast cancer? He's an oncologist. You can't make that diagnosis unless you've had a biopsy. And she said, no, I know what it is. I don't need a biopsy. Just go about your business. I tried a couple more times. She was absolutely adamant, but always hanging over me that threat that if you keep pushing hard enough, I will never forgive you. And Jane was an amazing, amazing person. And you just did not want to be on her bad side. And so I, for better or worse, capitulated and kept her secret and never mentioned it to her again until she collapsed 4 years later.
So you chose to accept it, as you just laid out, and then you kept the secret. I'm taking it from colleagues and friends and neighbors and family. What was that like for you? And what do you think as you've gone back and, I guess, to use the term soul searched and tried to understand where you were at during this, but why do you think you did it?
Well, it's such a complicated question with a really complicated answer. As I just hinted, there was just nothing worse than being on Jane's bad side. She was just really, really good at freezing you out if she was upset. And there was nothing better than being on her good side. It was just wonderful to sort of bask in the glow of this, the approval from this really wonderful, brilliant person who could be very caring when she wanted to be. So I, again, for better or worse, probably for worse, decided that I would do what she said. Now, I think there's some complicated psychological reasons why I may have done that, sort of this need to comply with her wishes. I have enormous regret. Maybe the thing I regret most in my life was that I couldn't figure out a way to convince my wife to get the medical care that she needed. And I've gone over this, and I still, to this day, can't think of a good way to have gotten that done, that still respected her autonomy. And honestly, it's one of the reasons I wrote the book, to try to put a narrative around this, to figure out what happened. But even having written the book and having thought about this for the past 10 years, I don't have a really good reason.
And that's okay. Like we said, we don't always have all the answers, but we talk about, respecting people's wishes in their death, but you were respecting her wishes while she was alive, and I can see that. I want to talk more about the book in just a moment, but Dr. Jensen, I want to bring you in here because you really introduced us to this story of Dr. Rollins and Dr. Weeks, his wife Jane. You had Dr. Rollins on your podcast, Bench to Bedside. What has fascinated you particularly about this story?
Well, I think one of the dynamic tensions in the book is the fact that Dr. Weeks's expertise, her training, and really everything about being a physician was, the exact opposite of what her personal constitution told her to do when facing this dilemma. And, that's one of the fascinating things about this story is that it's such an unusual circumstance where someone who you would think would have every tool at her disposal to, deal with this diagnosis in a way in which she literally spent years training for, would decide to essentially do the exact opposite. But what's interesting when you start peeling back the layers of all of this is that her particular area of expertise, which I think, we can sort of summarize by saying that she really was a leader against the kind of the previous dogma that quantity of life is more important than, say, quality of life, or quality of life was not factored into a patient's equation. And she was one of the people who said, no, that's not right. We need to take into account, a person's preferences and what they believe is important for the quality of their life, and not just be a blind adherent to quantity. And when you begin to take that into account, it's maybe there's a way you can sort of figure it out why she made the choices that she made.
Well, again, you use the word choice, just your own choice about your own life and your own destiny. Do you think that plays into it or could play into it? You deal with cancer patients all the time, and it's
Sure.
all about working in tandem with them and what their wants and wishes and desires are and what their goals are.
Yeah. I think, as I said, this story has a lot of different layers, and I think part of it, frankly, is that Dr. Weeks was somebody who wanted to always be in control. Mm-hmm. And, I think one of the things that she was concerned about was that there is this incredible loss of control when a cancer patient kind of enters the realm of medicine. And she had certainly seen that, hundreds, if not thousands of times. And she really wanted no part of that scenario. She wanted to maintain, I think, as much control for as long as she possibly could. And I don't know what Dr. Rollins thinks about that analysis, but I'd love to hear his perspective on it.
Dr. Rollins?
Yeah, well, I think Roy is exactly right. Jane worked very, very hard to get to where she was. She was inordinately proud of the fact that she had become a full tenured professor, one of the few female full tenured professors at Harvard Medical School. She was a leader in her field. As Roy hinted, she actually created the field of outcomes analysis in oncology and was devoted to this idea that patient preferences are important, and that in particular she was a warrior against the utilization of futile therapies by oncologists. And so when she made these preferences known to me, the sort of calculus that I went through was, well, can I support her? And, if I think about a patient who might not be my wife and, could I support someone making that decision? My first question would be, well, does he or she really understand the implications of making this decision? Well, nobody knew more about what was going to happen to her than Jane. She was the most informed patient you could possibly imagine. And so granting her autonomy in this sphere in many ways was a very logical thing to do. Although, there is a sort of counter argument that maybe she did not, for psychological reasons, know what was best for her. But certainly, just from the view of autonomy and sort of, when we talk about meeting patients where they are, I think it made sense to meet Jane where she was.
Gosh, that really, just what you said, that made a lot of sense, and just kind of finding yourself in this strange world of wanting to, as you mentioned, nothing better than being on Jane's good side, but also knowing that she kind of knew what was best for her wherever she was in her life. I did just want to touch on that. Do you mind mentioning just kind of psychologically the role that may have played, or maybe what you have thought over the last decade may have been? Because I think it's always really important that we touch on mental health issues whenever we can.
Yeah, I think that's a great point. So one could make a sort of logical argument about why Jane did what she did. As Roy said, she was a scientist who worked on autonomy and not getting futile therapy. By the time she had that event in the bathroom, she had metastatic breast cancer, which, especially when this happened, that is not a curable disease. It's a disease that with therapy, you can make people's lives better. It's very difficult to cure metastatic breast cancer. And you could say that she knew that, and she decided she didn't want to have therapy because she knew what the outcome was going to be. And it's all very logical, and it's all very self-contained, and she knew what she was doing. The problem is, well, actually two problems. One was right before I brought her home from the hospital after she had her collapse. She had a big pulmonary embolus, took a couple of weeks, almost a month to recover. Then I brought her home. Right before I brought her home, I was cleaning up our bedroom to get ready for bringing her home. And I discovered in the back of her dresser drawer, behind her underwear, were something like 40 bottles of medication, and most of them were oral chemotherapy that she had prescribed for herself. So it wasn't just that she didn't want therapy. She treated herself on the sly, which is incredibly dangerous because she was giving herself drugs that could have lowered her blood counts, led to some bleeding. Maybe that's why she was bleeding on the bathroom floor. She was flying blind. So it wasn't that she was a complete therapeutic nihilist, as we say. And also, when her cancer first appeared 10 years before she died, it was small then. And she could have had treatment then that might have actually cured her. So in addition to whatever else we want to say about her logical approach to this, her rational approach, I think the other psychology was she was deathly afraid of medicine. I mean, in all the years I knew her, 30 years, she never had a mammogram, never had a colonoscopy, never had a primary care physician. And she was deathly afraid of losing control over her career and the way she was perceived. So all of that ended up mixing together into a sort of toxic combination that led her to do what she did.
Dr. Rollins, talk to us about the series of events after that 3 years after that initial event that happened at your home in the bathroom. Then she collapses at work. Tell us about the series of events from there on.
Well, so one of the really fortunate things in my life was that Jane and I worked together at the same hospital for our entire professional lifetime, and it was wonderful. One of the benefits was that we went into work together, we came home together, but we also had lunch together every day. And I can still remember a beautiful, clear September noontime. We were walking to lunch together, and she was kind of walking more slowly than usual, and she seemed a little out of breath. And we got right to the cafeteria, and she just sat down and said she couldn't go any further. And then she started breathing very heavily and had this panicked look in her eyes. And, I went to try to find a wheelchair to take her to the emergency room, couldn't find a wheelchair. By the time I got back to her, she was actually lying on the floor, unconscious, and someone called a code. A resuscitation team came and stabilized her enough to get her to the emergency room at the hospital we work with, the Brigham and Women's Hospital. And it was there, by the time I caught up with her, in the emergency room. She'd already been intubated. She was on a ventilator. And they had taken her clothes and put her in a hospital Johnny. And that was the first time that I actually saw the enormous mass that had replaced her breast. It's just inconceivable that she lived for as long as she did with this huge, discolored, black, rotting, foul-smelling, just every bad thing you can imagine just growing on her chest. And I just looked at it in disbelief. And I remember one of the emergency room doctors coming up to me and saying, "So what's her history?" And I said something like, "Well, yeah, it looks like she had a pulmonary embolus." And he said, No, I know that. What's her cancer history?" And I had to sort of look him in the eye, this poor woman's husband, and look him in the eye and say, "Yeah, I don't know." It's inconceivable. But so in the emergency room, because of her blood clot, they got a CT scan of her chest to look to see where the clot was. And it was that CT scan that showed that her cancer had spread to her lungs and her bones and her liver. And so all in the space of an hour or so, my wife almost dies from her pulmonary embolus. I see this enormous mass in her chest. I'm told that she has, I remember I looked at the CT scan with the radiologist, seeing, basically what I saw was Jane's death sentence. I could see that she wasn't going to live much longer based on how much disease she had. That was, it was a very, very, very striking set of experiences.
And then how much time did you have left with her?
Almost 1 year to the day. After she was stabilized in the ICU and did a little bit better, I brought her home. And with the help of some absolutely amazing visiting nurses. The nurses were just lifesavers, because it was a very complicated matter to change the dressing on this huge mass every day. And eventually, after about 6 months, we had to change it twice a day. And these nurses just showed up like clockwork. The only day they didn't show up was the day of the Boston Marathon bombing, which was, Jane was sick and in bed. But even then, by then I knew how to do this, and so I could do it alone. But it was a long slog, trying to keep Jane comfortable and making her last year of life as comfortable as it could be.
Dr. Rollins, I'm going to get to some community questions because we have a few. Monica wants to know, as I'm sure we all do, I know I sure do, just what life has been like for you this past decade after Jane's death. What are you doing now? How are you doing now?
There are two main things I want to talk about in terms of, what life has been like, sadly, after Jane. And they're both good things. The first is that while Jane was sick, and even in that 10 years before she got really sick, I was unhappy. I didn't know what was going on. And I really could have used some psychotherapy desperately. But I didn't do it because I was afraid that even telling a shrink who is, committed to confidentiality, that would be betraying Jane's secret. So I didn't seek help. But within about 5 days of her death, I'd gotten a referral by one of my good friends at Dana-Farber to an outstanding psychotherapist. And I have continued to see her for the past 10 years. And it's been incredibly helpful. Anybody who, finally finds themselves in psychotherapy will say the same thing. Why didn't I do this earlier? This is fantastic. So that's one thing. The second thing, which is almost unbelievable, is that I remarried. And the person that I married, I never thought I'd marry again. I figured I had one long marriage to somebody pretty special. You don't really deserve more than that. But I did remarry. The person that I married turned out to be one of Jane's classmates at Harvard Medical School, who I met on the same day I met Jane in 1983. She was actually a student on my team when I was a resident at one of the Harvard hospitals, and Jane was a student on another team. And the student and I we made this connection, but she was engaged to be married to a classmate. I started asking out Jane, and so we didn't think about things. But 30 years later, after Jane died, this person sent me an email, a condolence email. I responded. We ended up having lunch together. One thing led to another, to another, to another, and now we're married and incredibly happy with a couple of dogs. So as awful as some of the things were near the end of Jane's life, I end up considering myself an incredibly lucky person.
Oh, for sure. We're going to have you back and find out what your secret is to not finding one, but two really great women in one lifetime. So congrats to you on that. We're glad you're living life well. A question from David. Just looking back, you mentioned regrets, but is there one thing that you maybe would have done differently? If you could narrow it down to one thing, what would it be?
To have the strength to confront Jane, sort of hold her head in my hands, look her in the eyes, and convince her that she needed help. You know, maybe she wouldn't have lived longer with therapy. That's possible. But she would have lived so much better. I can't tell you how awful it was for her to deal with this thing on her chest. And, you know, if she could have been treated 4 or 5 years earlier, I think that her life would have been better.
Dr. Rollins, the book you wrote is called In Sickness, and Shirley wants to know just how have family and friends reacted to the book since you put it out?
Well, another great question. So I was scared to death. You know, it's one thing to write something and feel good about it. It's quite another to actually publish it. And there are complicated reasons why I decided to publish it. But I was scared to death that people were going to be angry. One of the many things Jane was really good at was being a mentor. She trained a whole cohort of people who are in great jobs now and doing extremely well. And they're so devoted to her. Incredibly devoted to her, and I thought they were going to rip me to shreds when this book came out. Instead, the majority of them say things that I wouldn't have anticipated, like they keep saying I was brave about doing this. There's no bravery involved, but I think there's something satisfying that they feel about seeing this story and understanding some things that Jane may have done in the last third of her life that were otherwise inexplicable. But I will say that there are a core of a couple people who are upset. And what they tell me, they're not overtly angry at me, but what they say is, I'm not going to read this book. I'm not going to read this because I want to remember Jane the way I remember her. And I think, fine. Any response at all to this book is valid, and that's great.
Well, I can say, like the book, not like like it, don't like it. There's just so much love that I see and hear from you towards Jane. And my last question to you is just, what do you want Jane's legacy to be? People are going to read the book and have all sorts of things and more questions. They're going to have more questions and answers. So what do you want her legacy to be?
Yeah, I would be very upset if this book tarnished her legacy at all. I think she has two legacies, one that was intentional and one that was unintentional. The intentional legacy is all this fantastic work she did about sort of holding oncologists to account when they make decisions about providing therapies that could be toxic or difficult or painful for patients. And I think that is a wonderful legacy. I think, there are patients all over the world whose lives are better because of Jane. The unintentional legacy is to make oncologists more aware of patient preferences and patient autonomy, and to take the time to understand what patients really want and to make some compromises with our professional assessments to accommodate what those patients want. And I would be very happy if that attitude were sort of pinned to Jane's memory.
Well, Dr. Rollins, thank you for the work you and Jane have done at the forefront of medicine. We appreciate that. We know Dr. Jensen's doing the same thing. And I want to get your final takeaway. What do you want people to really get from this story?
I think it's the fact that patients bring their own perspective to their individual diseases, and we have to respect that. And in a typical physician patient relationship, if say the physician very much disagrees with what the patient wants to do, you can refer them elsewhere. Obviously, Dr. Rollins did not have that avenue available to him, and so he was really forced to deal with Jane's wishes and had, I think, very little choice in the matter. And I think this book really speaks to how many layers there are in this whole story. And obviously a complicated situation, and I think the best part of the story is that you have come out, the other end of this, and have a great life now, and can look back and reflect, and it is a powerful message for a lot of folks in medicine.
Dr. Jensen, thanks for being with us today and bringing this special guest along with you.
My pleasure.
Dr. Rollins, what do you want folks to take away from our conversation today?
I want people to be more forthcoming. One of the things I've discovered since writing this book is I've sort of identified inadvertently the tip of an iceberg. Most of that iceberg has to do with patients and family members who are hiding their diseases, maybe out of fear, who knows why, but come forward. You have nothing to lose but your anxieties. If you do come forward, we need to be more accepting. That's what I would like people to take away.
Dr. Rollins, thank you so much for being with us today. It was a pleasure meeting you.
Likewise.
And thank you to all of our guests today for your questions. We will see you back here tomorrow at 8.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.